Hello everyone, I'm here with the radiology team. This is your host. Today we're going to look at a non-contrast CT scan and talk about what it means when it says that there's S-mild generalized brain atrophy seen. So let's take a look. So these are the findings from a 68-year-old female who presented to the emergency room with altered mental status. And this is a non-contrast CT of the brain that was performed. When you look at the technique, it's non-contrast, which means there is no contrast used in this study. Contrast would be an iodine-based material that highlights certain structures on the CT scan to allow us to look more closely at those specific structures. With a non-contrast CT scan, we are limited in the structures that we can evaluate. However, we can still see the overall brain parenchyma, or the brain tissue, and look for any abnormalities. When we look at the findings, it says bilateral cerebral hemispheres reveal normal attenuation. That means that the density of the brain tissue looks normal. And we should expect that to be the case. Because if there was an acute problem with the brain tissue, say an acute ischemic stroke or an acute hemorrhage into the brain, we would expect to see abnormal densities. We would either see areas of hypodense or low density, suggesting that it has a stroke, or areas of hyperdensity, suggesting a bleed or an area of hemorrhage within the brain, and we don't see that here. The brain tissue looks relatively normal in its density. The brain tissue also shows normal gray-white matter differentiation. That means that we can clearly see the gray matter, the outer layer of the brain, and we can see the white matter beneath it. And the white matter has a slightly different density than the gray matter. It's a little bit denser, but we can clearly make that differentiation. If we couldn't, if they were both appearing the same, that could suggest a number of different problems. One of them being sodium valproate, which is an anti-seizure medication that can cause this change in the brain. But since this finding is completely normal, it suggests that that medication is not causing any adverse effects in this patient. It also says that the bilateral basal ganglia and thalami are normal. The basal ganglia and thalami are structures deep within the brain. They are areas that we look at to help us evaluate for a number of different conditions. And they appear normal in this patient. It says there is no evidence of intracranial hemorrhage. That is good to see, because that would be a bleed within the brain that can be potentially life-threatening. And it can be caused by a number of different things, including trauma or an aneurysm. We do see that the ventricular systems are mildly dilated. The ventricular system is the set of interconnected ventricles that contain cerebrospinal fluid. And it's important that we evaluate these, because if they become too large, it can be a sign of a number of different problems. Most commonly, hydrocephalus is where there's an imbalance between the production and absorption of cerebrospinal fluid. And so it can lead to a buildup and dilation of the ventricular system. The next finding is that the superficial CSF spaces are prominent. This is probably referring to the subdural spaces. The subdural spaces are the potential spaces between the surface of the brain and the dura. Normally, they are actually quite small, but when you have brain atrophy, they can become a little bit larger. And since this patient has brain atrophy, we would expect to see this finding. Another important thing to note is that there is no shift of midline structures. That means that all the structures in the middle of the brain, including the brainstem, which is where we find the midbrain, pons and medulla, as well as the third ventricle and the fourth ventricle, they are all in the center of the brain. If there was a mass or a bleed or an area of swelling, it could cause a shift of those structures to one side. And we don't see that here, which is good to see. Finally, it says that the cellar, supracellar, and the paracellar areas are unremarkable. The sella turcica is the bony structure that houses the pituitary gland. And we want to make sure that the pituitary gland is not causing any mass effect on the brain. If it was, say, if there was a large pituitary tumor, it could cause the brain to shift. And we could potentially see signs of compression of the optic chiasm, which is the point, where the optic nerves from each eye come together. And we don't see that here. The brainstem and cerebellar parenchyma also shows no altered density. The cerebellum is the structure at the back of the brain, and the brainstem connects the cerebellum to the rest of the brain. And we want to make sure that there's no abnormal densities in these structures. Again, if there was a stroke or a bleed, we would expect to see some kind of abnormal density here, and we don't. And finally, it says that the CP angles are clear. The CP angle is the potential space between the cerebellum and the occipital lobe of the brain. It can sometimes be difficult to evaluate this area on CT scan, but it appears to be normal in this patient. So, in summary, the main finding on this CT scan is mild generalized brain atrophy. Brain atrophy is where there is loss of brain tissue. It can be caused by a number of different things, including aging, and it can also be a normal variant. So while this is an abnormal finding, it may not necessarily be pathological, meaning it may not necessarily be causing the patient any problems. And that SYNS, important to look at the clinical history and correlate these findings with the clinical picture to determine if this finding is significant or not. I hope you enjoyed this case.